Can 5G signal transmit COVID-19? Also, do antibiotics work against COVID-19? Let's find out tonight. Let's go.
Good evening guys, my name is John and I'm a critical care provider. Welcome back to our channel. If you're new to this channel, we talk about mathematics, health and life sciences, career tips, and educational tips or examination tips like your IELTS, OET, and CBT. In this healthcare vlog, we're going to talk about COVID myths. Before we begin, thank you very much everyone. We've reached 1,000 subscribers. And massive shout out to my ICU colleague and friend Tanya and her partner team. So they've got a YouTube channel and it's called Lazy Tinya. In fact, they gave me this t-shirt. Thank you very much, Lazy Tinya, Tanya and Teen. So more power to your channel. So guys, if you can subscribe to their channel, that would be wonderful. So guys, let's start.
Myth: young people are not susceptible to the COVID-19 virus. Fact: people of all ages can be infected with COVID-19 virus.
So people of all ages can actually get COVID-19, especially if you don't wear your mask, social distance, and wash your hands, of course. Also, if you got medical conditions like asthma, diabetes, or heart diseases, then you'll be more vulnerable to becoming severely ill with COVID-19.
Myth: once you catch COVID-19, you'll have it forever. Fact: catching COVID-19 doesn't mean you'll have it for life.
So COVID-19 is caused by a virus, coronavirus, that's why it should go on its own. But unlike flu, COVID-19 doesn't have a known treatment to date. So what we're doing is treating symptoms of COVID-19, including cough, colds, fever, and shortness of breath. Also, your COVID-19 swabs may come back positive within 90 days of you becoming COVID-19 positive, but your body has generated or produced antibodies, so it shouldn't be forever.
Myth: if you're able to hold your breath for 10 seconds or more without coughing or feeling uncomfortable, you're COVID negative. Fact: being able to hold your breath for 10 seconds or more without coughing or being uncomfortable does not mean you're COVID free.
So we can't confirm COVID-19 just because you're uncomfortable while holding your breath. Remember, breathing is needed to survive. We need to breathe to survive. Also, breathing is spontaneous, it's voluntary, so delaying it will just delay oxygen transport in your body. Remember, the most common COVID-19 symptoms include shortness of breath, dry and continuous cough, and fever equal or more than to 38 degrees Celsius. So if you've got one of this, you must stay at home or self-isolate and have your PCR test done.
Myth: prolonged use of medical masks can cause oxygen deficiency or carbon dioxide intoxication. Fact: prolonged use of medical masks does not cause oxygen deficiency or carbon dioxide intoxication.
While prolonged use of medical masks may be uncomfortable, it shouldn't deprive us of oxygen and it shouldn't accumulate carbon dioxide. Just ensure your mask fits properly and it's tight enough for you to breathe normally. Also, never use the same mask or medical mask and change it when it gets damp.
Myth: you should wear a mask while exercising. Fact: you don't have to wear a mask while exercising.
Some people wear masks in the gym or during exercise to prevent catching COVID from other people. But do you know that when the mask gets wet, it becomes harder for us to breathe and it accumulates microorganisms or germs as well. So the World Health Organization suggests maintaining physical distance of 1 meter during exercise.
Myth: COVID-19 can be spread through mosquito bites. Fact: COVID-19 cannot be spread through mosquito bites.
So COVID-19 is spread or transmitted via droplets such as coughing or sneezing. It's different from vector transmission, which involves vectors like mosquitoes to spread infection. One example is dengue fever. So to prevent droplet spread, be sure to wash your hands thoroughly with soap and water for 20 seconds or use alcohol-based hand rub. Also, avoid close contact with people who are coughing and or sneezing.
Myth: cold weather and snow kills the COVID-19 virus. Fact: cold weather and snow cannot kill the COVID-19 virus.
While some microorganisms can be very sensitive to cold, there's no sufficient evidence that says that the COVID-19 virus can be killed in cold temperature. Although here in the UK, the highest incidence of respiratory infection or chest infection is during winter. The best way to deal with this is to wash your hands thoroughly with soap and water for 20 seconds and dry your hands as well, or use an alcohol-based hand rub. Also avoid touching your eyes, nose, and mouth if you haven't washed your hands.
Myth: 5G mobile networks can spread COVID-19. Fact: 5G mobile networks do not spread COVID-19.
So guys, remember 5G networks won't spread or transmit COVID-19 because remember the mode of transmission is droplet spread. For example, coughing or sneezing. So the only way a 5G network smartphone will be able to spread COVID-19 is when you touch a COVID-19 positive smartphone and you didn't wash your hands and you touch your eyes, nose, or mouth.
Myth: thermal scanners can detect COVID-19. Fact: thermal scanners cannot detect COVID-19.
So thermal scanners, thermal sensors, they can check temperatures but they cannot detect COVID-19 because there are various causes of having high temperature. So according to Healthline, the following are some causes of fever or high temperature in addition to COVID-19. Flu, immunization, food poisoning, extreme sunburns, and teething, especially in pediatrics or in children. So remember that if you got a fever of 38 degrees Celsius or higher, isolate yourself at home and be sure to have your PCR swab done.
Myth: shoes can spread COVID-19. Fact: the likelihood of shoes spreading COVID-19 is very low.
So WHO says that the risk of spreading COVID-19 via your shoes or through your shoes is very minimal. So if you got small children or babies at home, the best thing to do is to leave your shoes outside your house or at the entrance so they won't reach them. And this will prevent them from ingesting these pathogens or microorganisms or germs causing fever or any other illnesses.
Myth: water or swimming spreads COVID-19. Fact: water or swimming does not spread COVID-19.
So the WHO said that swimming won't normally spread COVID-19, but infection happens between people when someone has got close contact with an infected person. The prevention for this include avoiding crowds, maintaining 1 meter physical distance, and wearing your mask if you're out of water and you can't social distance.
Myth: ultraviolet or UV lamps can be used to disinfect your hands and skin. Fact: ultraviolet or UV lamps should not be used to disinfect the hands or other areas of the skin.
So ultraviolet or UV radiation can actually damage your eyes and your skin. So to disinfect your hands, just wash them thoroughly with soap and water for 20 seconds or use an alcohol-based hand rub.
Myth: hand dryers can kill the COVID-19 virus. Fact: hand dryers are ineffective in killing the COVID-19 virus.
So according to WHO, there's no sufficient evidence or data that says that hand dryers can actually kill the COVID-19 virus. So part of prevention, hand hygiene, using alcohol-based hand rub or washing your hands thoroughly with soap and water for 20 seconds.
Myth: rinsing your nose with saline prevents COVID-19. Fact: rinsing your nose with saline does not protect you from COVID-19.
So again, the WHO or World Health Organization said that there's no evidence that rinsing your nose with saline can actually protect you from COVID-19. Although there's some evidence that regularly cleaning your nose with saline can actually help you recover more quickly from common colds, it hasn't been shown to prevent respiratory infections.
Myth: taking a hot bath prevents COVID-19. Fact: taking a hot bath does not prevent COVID-19.
So hot baths cannot really protect you from COVID-19. Actually, they can be harmful to the body because hot bath may lead to burns. So the best prevention is washing your hands thoroughly with soap and water or using an alcohol-based hand gel.
Myth: pepper can cure COVID-19. Fact: adding pepper to your meals does not prevent or cure COVID-19.
So while pepper can add taste to your food, there's no evidence that says it can protect you from COVID-19 or it can treat or cure COVID-19. So just ensure you wash your hands thoroughly with soap and water and maintain social distancing.
Myth: drinking or spraying methanol, ethanol, or bleach prevents or cures COVID-19. Fact: drinking or spraying methanol, ethanol, or bleach does not prevent or cure COVID-19.
So methanol, ethanol, and bleach can be used as cleaning products, and drinking them may lead to disability or even death. So to protect yourself from COVID-19, never ever ingest or drink these products. You may use them as cleaning agents for your table or kitchen counters, but never ever drink them. Okay, so just wash your hands thoroughly after using these products and wear gloves as much as possible when using these products.
Myth: drinking alcohol protects you from COVID-19. Fact: drinking alcohol does not protect you from COVID-19.
So excessive alcohol intake is also harmful to our liver, which detoxifies and cleanses our body. So without a healthy liver, our body won't be able to cleanse itself from waste products or toxins, and this will just build up and we end up being poorly and we end up dying.
Myth: vitamin and mineral supplements can cure COVID-19. Fact: vitamin and mineral supplements cannot cure COVID-19.
While vitamins A, B, C, D, E, and K and minerals can boost our body's function, there's no evidence saying that they can actually treat COVID-19 infection.
Myth: hydrochloroquine can be used as COVID-19 treatment. Fact: hydrochloroquine does not have clinical benefits in treating COVID-19.
So hydrochloroquine or chloroquine are some medications that are used to treat malaria or some autoimmune diseases. However, some research findings showed that these medications had little to no impact at all when it comes to COVID-19 hospitalizations or deaths.
Myth: antibiotics are effective in the prevention and treatment of COVID-19. Fact: antibiotics cannot prevent or treat COVID-19.
So this is one of the most common COVID-19 myths. Remember, antibiotics or antibacterials target bacteria, and then antivirals target viruses. So you can't just administer or give antibacterials or antibiotics to target viruses. Okay, otherwise you won't treat the infection. That's why we give antivirals such as remdesivir during the first few days of the COVID-19 disease process. But when do we start antibiotics? The doctors prescribe antibiotics if the patient starts developing another infection. For example, chest infection, also called COVID pneumonitis, or pneumonia stemming out or resulting from the COVID-19 infection.
Myth: pneumococcal vaccine protects you against the COVID-19 virus. Fact: pneumococcal vaccine does not protect you against the COVID-19 virus.
So the World Health Organization said that your pneumococcal vaccine and influenza vaccine couldn't protect you against COVID-19 infection because the virus is just new and it needs its own vaccine. However, vaccination is very important, so please have your 2 vaccine doses against COVID-19. And in some countries, like here in the UK, they've started rolling out the booster doses, okay, for healthcare professionals. So this ends our video for today. It's COVID-19 Mythbusters. So again, to my subscribers, thank you very much from the bottom of my hypothalamus. No, from the bottom of my heart. Thank you very much for subscribing to this channel and supporting this channel up to date. Okay, and now we've got 1,000 subscribers. So I'll see you in our next vlog and stay safe everyone. Bye!